WVPA has put a lot of focus in the last 3 years into being present in our students' journey to becoming pharmacists. And after this conversation, it's completely clear why. The future is bright for the pharmacy profession with students like Allison, who are excited for the opportunity to learn as much as possible about the pharmacy profession, but also possess the intangibles like a huge heart to care for people on an emotional level. Allison joined the board of directors in April as a student representative for my alma mater, the University of Charleston School of Pharmacy. And after only a few short months, she is leading the ASP chapter at UC and contributing to the West Virginia Pharmacists Association in a big way. When I first met her, I felt there was something special about her, and every interaction you have with her just solidifies that. This conversation is around her American Pharmacy Month essay, which won our contest back in October. Students, be on the lookout for another contest in October to celebrate American Pharmacy Month, and you could be the next on the podcast. Do you have a great idea for a podcast episode? Email us at info@wvpharmacy.org. And make sure you are getting our free e-newsletter at wvpharmacy.org, full of great information to share with patients and updates on programs like the Technician Immunization Training Program coming soon and the annual meeting at Stonewall October 7th and 8th. Stay informed with us through social media on Facebook, Instagram, LinkedIn, Twitter. We support you so you can support your pharmacies, your staff, and your patients. Our next guest is Allison Given, a P1 student at the University of Charleston School of Pharmacy, originally from Manassas, Virginia, about an hour outside of Washington, D.C. And we are sitting down to have a discussion about her essay submission that was the winning submission for our contest during American Pharmacy Month. The theme of it was improving healthcare, increasing access. So welcome, Allison. Thank you for coming on the podcast. And I want to turn it over to you to read your essay to us so that everybody can hear what it is that won the contest, and then we can have a little bit of a discussion about what it means to improve healthcare through increasing access. So, Allison, take it away.
Thank you. Happy to be here. To me, improving healthcare by increasing access means pursuing the concept of a world without illness that science fiction writers often dream of. Almost a year ago now, I was talking about Star Trek with my father, and he had mentioned how advanced the medical technology in the series was. Sorry. Being a pharmacy student freshly accepted to a program, I was quick to point out that we are very capable of medical marvels today. We have doctors who can transplant hearts into patients and grant that patient a new lease on life. We have medications that can remedy scores of illnesses without picking up a scalpel. We can view a beating heart or functioning brain in real time through medical imaging. Medicine operates on the cutting edge of innovation, and there's always a newer and better system in the works. My father responded with pointing out that these advances mean very little when they cannot be accessed, and that we still live in a world where disease states that we have tools to treat still carry a death toll, and he was right. What good does an epinephrine autoinjector do when it sits on a shelf in the back of a pharmacy gathering dust? I've had the privilege to work as a pharmacy technician for several years before entering a pharmacy program, and I've met the most kind and caring people in pharmacies. I have no doubt that if someone were to experience an anaphylactic reaction in the building, that epinephrine pen would be removed from the shelf and utilized without any concern over payment. The issue is that the pharmacy is not normally where anaphylactic reactions occur. They occur on playgrounds, in lunchrooms, in restaurants, and 1,000 other potential locations where life-saving epinephrine is not readily available. Medicine needs to be where people are in order to have a positive impact, and pharmacists serve as essential players in making sure the right medications get to the right people and are used in the right fashion. We know compliance with maintenance medication produces optimal outcomes for patients, and we know that access to emergency medications and emergency care improves patient outcomes after acute health events. It is not enough that the technology to prevent serious illness exists. It needs to be accessible when it is needed. If medication cost makes medication access a privilege of wealth, then we have not created a cure. We have only created another injustice by which the average person suffers. What good does a groundbreaking medication do when it sits on a shelf or is only accessible by a privileged few? For pharmacists, taking a position on the issue of medical accessibility is essential. The pharmacist is the healthcare worker that patients associate with the rising cost of their medicine, though pharmacists have little say in how medication is priced and how much insurance companies will cover. Pharmacists are the face associated with prescription drug pricing, and it is important that patients know the goal of pharmacists is to get their medication to them in a timely and affordable manner. Pharmacy staff see firsthand how hard it is for patients to afford their maintenance medications. They see firsthand the Herculean effort it takes for some patients to be medically compliant, when the compliance involves a variable cost near several $100s every month. Pharmacists must advocate to increase medical accessibility because this profession sees firsthand how inaccessible healthcare is becoming. If we do not stand up for our patients and accessibility, who will? Improving healthcare by increasing accessibility means making essential medications that already exist easier to access so that they may be used to treat every patient without the restriction of a hefty price tag.
That's awesome. And I told you off camera, but I want to make sure to reiterate for the podcast that when I first read this, like, it really resonated with me. And unfortunately, I read this back in October during American Pharmacy Month. And I told you that we were going to bring you on the podcast. And then it's almost like 6 months later, I'm actually getting around to sitting down with you. But before we came on, I went to read it again. And I had that same feeling listening to you and reading it myself, that it was like so spot on of how I feel as a pharmacist. I mentioned to you earlier that one of my changes in my career, I felt like when I came out of pharmacy school, I was extremely interested in making a difference and helping people. And I would often refer to myself as like a patient advocate or patient care advocate. And probably about 5 years in, I realized that I had to change that moniker to include affordable, because patient care isn't patient care unless it's affordable for them, because you're only putting extra barriers between them and that treatment, or you're putting undue stress upon them in order to try to get that treatment. So I quickly learned the importance of making things affordable. And we also mentioned just a little bit ago about how we're in a unique position because we see the patient at the end line of that care in the form of medications. And so a lot of times we have other healthcare providers that provide that service, but they're not the ones responsible for the billing of that service or making sure that the patient pays that service. They have financial departments that take care of a lot of those things and bill insurances and stuff. And we're the ones that are doing both at the same time. We're delivering healthcare and we're trying to figure out the financial component of it. So you had mentioned that you were a technician for several years before you came to pharmacy school. Tell me a little bit about how that experience shaped how you viewed going into pharmacy school and what your motivators might have been.
My experience as a technician, I think it really gifted me with a very human, the humanity focused side of medicine, where I figured if they accepted me into pharmacy school, I was probably smart enough to do this. Okay. But did I have the ability of my person and my talents to provide this care that I was saying I could do, and I was going to spend 4 years of my life then learning to provide this care? Did I have the emotional, spiritual, intellectual strength to do this? And being a technician really helps me with that, because I've had the privilege to work in a couple different environments of retail pharmacy where I started in a very rural pharmacy, and then I moved to a more suburban pharmacy. And then I was then in Charleston finishing my undergrad. And each had its own set of medical inaccessibilities where I had patients in the rural setting where even if they could afford their medication, we had an additional barrier of they can't wait 20 minutes and it's a 2-hour drive home. So what am I going to do to get this in their hands before they go? And then a suburban setting was a little more difficult with people would get out of the local ER and need medications, and the pharmacist and I would be closing the pharmacy for the day. You'd have someone show up looking for a pain medication, and I can't physically turn people away if I know that they're ill and this is something that has come up. So I would have to make do to meet this accessibility. But cost was never a issue that I had an easy solution to, because once I bill someone's insurance for Lantus and it's $500, that's what I've got. There's very little I can do in that sense. So I realized how important it was for pharmacists to be advocates for patients, not only publicly, but to insurance companies about here's what's going on and why things are going wrong.
Yeah. And so I met up with you at Pharmacy Day back in February, where we went around and spoke with legislators and made sure that they understood the impact that some of the bills that were being proposed, either positively or negatively, towards patient care. And you hit on the fact that like we have to be advocates for them in a number of settings, not just like in the pharmacy. And it was extremely inspiring to see. I think we had over 120 pharmacists and students and pharmacy owners and people from all over the state coming in. And in fact, from outside of the state, they were coming in because they just cared about the people of West Virginia. That it really brought back to me that some of what we're doing when we do the legislative part of it is providing care not for a patient on a like one-on-one basis, but on a much grander scale, that we can have a much bigger impact in people's lives. And when it came to legislatively, I think that West Virginia has always done a very good job of having success with the means that we're being given. And I mean, that's just the theme of West Virginia. I think we make the most of what we have. Every West Virginian, whether you're rich, poor, whatever background you come from, we always try to find a way to live within our means and to make do with the resources that are provided to us. That being said, it would be nice if a lot of our legislators would provide some of the care on an affordable level through rules and regulations and laws that would help to make the cost of medications more affordable, that would help to regulate the pharmacy benefit managers from taking more than they're giving to their patients and to the pharmacies that are helping to deliver that care. So I think the next question I want to ask you is, what was your experience at Pharmacy Day as a P1 student, your first time at the state capitol? What was that like?
The overarching theme of my P1 year with a lot of these opportunities, I feel like, is just pure terror for about 5 minutes as I walk into somewhere and I'm like in my white coat and I don't feel like I fit in here. So I'm looking around trying to gauge everything around me. So that there was a little bit of that. But I was really interested in talking to other students, especially, and pharmacists in the area. My meeting with my legislator was unfortunately canceled, but I was able to hang around where Dr. Acree had set up a naloxone booth to dispense naloxone. So I spent a little time there, and I kind of got to see that. I did see this a lot when we dispense naloxone. Is most people are willing to contribute to a better healthcare environment. It's just giving people the resources to, and to acknowledge that there is a deficit in healthcare in some way. And I think that, especially with the legislators, it's it can be difficult with how many bills are being introduced to them to read over, to look over what is affecting the average West Virginian for them to parse through all this information. But I think that keeping an eye on healthcare accessibility, which impacts a lot of people who I interact with, from medications to treat COPD, from naloxone to antibiotics to 1,000 other things that are going on, because there's so much going on in medicine. I feel like even just in Charleston to keep tabs of, and it's important that this stays in the forefront of their mind that people are sick and need help. And if we can't give people that help, there's no point in every other thing that we try to help them with, because if people are sick, not a lot else matters.
Right. And so one of the things about the legislators that a lot of people need to understand is that many of them do not have medical backgrounds. So if you think about how challenging and difficult it is for us to understand the healthcare landscape and how PBMs work and all the infrastructure that I think is in some way made to be confusing on purpose, they have even less of an understanding of it. So, their backgrounds vary. You've got some who have law degrees all the way to people that are small business owners. And I mean, we do have a pharmacist in our house who is always very good about making sure that pharmacy bills are at the forefront of the house discussion. There are other healthcare providers, nurse practitioners, doctors who are in the house as well. But the vast majority of them do not have that understanding of healthcare, even on like an elementary level. And so making sure that we get in front of them and try to educate them about what the healthcare system really is like. If you're a businessman and you think, oh, well, healthcare is just a business, like it's just dollars and cents. And no, it's so much more complex than that. And so getting those legislators to understand what is at the heart of most of those bills that either we propose or that someone else proposes that we're in favor of or we're against, either way, making sure that they understand what the implications are for that bill and that it's not as black and white as they might seem. So one of the things that I wanted to also mention was that as part of this contest, you won a $50 gift card from Amazon. And when I reached out to you to tell you that congratulations, you'd won, I want to bring you on the podcast, which seemingly was like never going to happen, but did happen. And you got this gift card. What did you do with it?
I asked for you to donate it to the Women and Children's Hospital. They had an Amazon wish list online that is accessible, and they just have lists of things that they need or would like. So I thought, let them have that because I don't need it, and they can probably make a lot better use of it than I could.
That's amazing. And so I don't know that I actually told you this, but the $50 gift card was used to purchase coloring books and little stuffed animals and stuff that was going to help kids who were in the hospital for one reason or another. But the part that I don't think that I ever told you was that I matched that $50. So they actually got $100 worth of stuff to go to helping children at Women's and Children's right there in Charleston. So I thought that was incredibly cool that not only did you have an amazing essay, but then it's obvious that your heart is so big that you were willing to give to others even after winning this. So congratulations on winning the essay. Thank you for your contribution to Women's and Children's. I'm sure that they appreciate it, and the kids that they helped with that definitely appreciate it as well. One of the things that we have sort of touched on is the role of pharmacists in trying to find creative solutions to financial obstacles. And so I know that in my own practice, it's not uncommon for us to call the prescriber to see if we can substitute with something that would be cheaper to utilize your patient assistance programs that are out there for certain brand name medications, even utilizing discount cards, which come with some of their own issues. That anybody who's been kind of watching the news will know that there was a decision by the Federal Trade Commission recently where they put I think it was $1.5 million fine on GoodRx for sharing people's healthcare information with Google and Facebook and some of the tech companies for targeted marketing and whatnot. So not necessarily every discount card is made the same. And so, kind of have to be careful about that part of it. But knowing that, like, sometimes if it comes down to it, getting it in patients' hands is more important than making sure that a few dollars and cents is saved, that the pharmacy makes a few dollars and cents in the process. So I'm fortunate to work for a chain pharmacy. And so I can say this probably a lot easier than some of my colleagues who work in the independent setting. But I've always said that as long as I don't lose money and as long as the patient gets medication, I don't care how much I make off of any prescription that goes out my door. And, I have a fiduciary responsibility to my employer to make sure that, I'm not just being very fast and loose with the medications going out of my pharmacy. But at the same token, I don't care how much my pharmacy makes in the process. I'm more concerned with taking care of the patients in my community. And when we start talking about PBM regulations and all these things that are causing healthcare costs to skyrocket, and that are not just healthcare costs, but the cost to the consumer, to the patient, is going up. I often look at my role in advocacy and legislation and trying to just make sure that I keep the lights on at my pharmacy so that I can continue to take care of those patients. So you hinted on the fact that you saw some of that firsthand with your background as a technician. Is there one story that sticks out, or one example that kind of is cemented in your memory as just being heartbroken that you could not provide somebody with the medication that they needed?
Yeah, I had an older woman stop by the pharmacy to pick up her insulin, and something had happened with her insurance one way or another where they were not covering anything anymore, and it had to be resolved. But insulin's not really a medication you can go without while a paperwork process takes place for who knows how long it would take to reinstate or whatever had to be done. So we were looking through everything we could to try to get her the medication that she needed some way where it would fit her budget. So we started with like 3 pens, and we're slowly working our way down to like 1 pen. And we're looking at coupons, and we're looking at if that insulin offered any kind of manufacturer coverage or coupon or savings. And it was just a lose scenario where I was going through every possible tool I had, and it just wasn't enough to counter the price of the insulin. So she did leave with 1 pen, but could she afford it? What happens when that pen runs out, and then what? She doesn't have the budget for it. Does she then insulin stretching, I believe it's called, is a very prominent issue with diabetes, where people will try to make a pen last as long as they can, when in reality, the clinical benefit they need is from the exact dose when they need it. But it's not possible, but it's not affordable.
Well, and you can Google and get tons of stories of patients that not only are stretching medications like that, but that are even going to the amount of trading medications with other patients who are no longer on the medication, or the insulin has expired and they're still using it because it's better than going without. And it's heartbreaking to hear those stories. one of the things that I'm in a little bit of a unique situation is that I work in a grocery store. So I will hear people say that they have to make a choice between whether they're buying groceries or medicine that day. They have to find out how much something costs, and then they'll go and put back stuff from their cart. And it's like, that that's something that they need. They we do suffer from a food insecurity issue in a lot of respects in our state and just on a national scale. There are communities or homes throughout all of our communities that wrestle with food insecurity, and that food insecurity leads to more negative health outcomes because they're not getting the right nutrition or they're not getting it at the right intervals. And so you have a lot of people who are storing or holding back medication, storing and holding back food that they're hoping that it will last them until their next paycheck comes in or until they have the means to be able to afford another either shopping cart or medication allotment. So it's I think that I see it a little bit more than some others do because it's so in your face when they're, pushing a shopping cart in front of them and that they're making decisions based on what the price is when they come by to pick up that medication. And that's heartbreaking. You see the tears well up in their eyes. You can definitely empathize that what they're going through, and yet you're really handcuffed in the system as far as what you can do to make that more affordable. The other component is just access to healthcare by having healthcare within transportation range. So we have 11 pharmacy deserts throughout our state. We do have food deserts throughout our state that make getting those things difficult for our West Virginians in those locations. And it always amazes me that that's even an issue because you would just think that's part of, there's a community, there's going to be a pharmacy, there's a community, there's going to be a grocery store. There's certain necessities that have to be at those locations. But what we're finding is that some of that access is being either expedited or changed based on insurance restrictions of where they can go to get their medications. So that's also providing an extra layer of added transportation, or if everybody is being funneled into the same pharmacy because the insurance is pulling everybody into one place, it's putting more undue stress on that pharmacy. And then you've got people who it's taking them longer to get their medications from said pharmacy. And at least in my case, personally, I can say that I've had patients that have come back to me who have paid out of pocket for things because at least they can get it quickly as opposed to driving further or finding transportation. Some people don't have reliable transportation. So just getting to where their medications are available and affordable to them can be a challenge as well. You had mentioned that you worked in a more rural location. So did your pharmacy do anything to try to help that rural community to get medications into their hands?
A little bit. So where I was at was a little bit west of Northern Virginia. So I think for my chain of pharmacies, we were the furthest west. And then there was one in 150 miles or something crazy where people drive that way. They're all going to go towards us. It was difficult, but in a lot of cases, like with a company, a lot of what we're doing, our hands were tied because I could offer, oh, we can sometimes ship medications to your house. But then a nuance with that community was a lot of people had PO boxes, so they would have to go to town anyway, and that didn't send them back home. So my time there was really just filling prescriptions as fast as I could and handing a little tote to a pharmacist, like, here, please check this real fast. And it was a very difficult situation. And there was a lot that I feel like that could have been taken into account, maybe needed some improvement just from like a company-wide, here's what a rural pharmacy needs to succeed versus a suburban pharmacy, because there's differences in your patient population, the demands of like what the needs of that population are, and what they need to thrive. And I don't think that's always taken into account with a lot of things, because I'll also see that with even the information sheets we hand patients with their medications. Is this at a reading level of medical literacy that they understand and grasp? Is this something that we understand after spending how much time in healthcare, but this is their first time learning about what diabetes actually is, that's an issue that occurs. So there are like things looking back in hindsight, I feel like we could have improved on, but I think we did our best with the tools we had. But I would be intrigued to see what could have been done better in the grand scheme of things.
Well, and I think that whether you work for a retail chain establishment or you work in a hospital or independent community setting, whatever your setting is, I think it's really important for you to take a good hard look at your patient population and see what the best way is to take care of them. If you are in one of those chain settings where a lot of the services and the programs and whatnot are kind of doled out in a mass fashion to everyone to do the same thing, it may require a little bit of tweaking at the individual pharmacy level to really make sure that that program is meeting the needs of the patient population. And so, looking at, like you had mentioned, health literacy, language, culture, there's so many different aspects of a person that can contribute to their understanding of healthcare or their access to that healthcare, and making sure that, at the end of the day, whatever it is that they need is being met, and that we're taking away those obstacles. And so, as much as it is a superb challenge to be a pharmacist, it's also extremely rewarding to be able to be that affordable patient care advocate that I spoke about earlier, that I claim to be, and I at least aspire to be. I think that we need to work on finding creative ways to take care of our patients. We're often this may be a dated reference for our pharmacy students that are listening, but we are the MacGyvers of the healthcare industry, that we're looking to make ends meet and find creative solutions to getting patients the care that they need. And as the theme of the essay was, to improve healthcare through increasing access. So I really want to thank you for coming on the podcast. You mentioned that you're almost done with your P1 year.
Ooh.
Give our pre-pharmacy students that might be listening to this pep talk of what that P1 year looks like and what you're looking forward to most in your P2 year.
Well, I joke around, say I was at a gross advantage compared to my classmates starting P1 year, because they all knew they were smart going in there, and I knew I was stupid. It was going to take a bunch of studying for me to get anywhere I wanted to be in this program. So I was prepared for that. I think that some of my classmates and peers were shocked by just how much information we receive in one class, in one lecture, and how important this information is. So study and study hard, but you 100% have this. You have access to so many peers, so many mentors, people want you to succeed. And if you reach out, if you have problems, need help, and say, I need help, you're going to meet like a dozen hands reaching back to help pull you out of that problem and help you proceed on. So study hard. Meal prep for sure. I didn't realize how little time I had to cook until I started pharmacy school. So everything's in the little freezer with the Tupperwares. Meal prepping.
Do a lot of cooking on your breaks between classes and stuff?
Usually I will quickly try to throw something together Sunday that I can eat for the week. But as soon as I get to breaks, my 16-year-old brother loves to cook. So I'm perfectly happy going home and being like, here's what I've been feeling since we've last talked. How do you feel about this recipe? And getting him to cook.
I love it. So my grandmother spoiled all three of the children in my family. And anytime I'd come home from pharmacy school, I'd always say, you know what I haven't had in a while? And I knew that like the next day I was getting it. So I appreciate the fact that you have somebody in your family that does the same for you. Again, I have to say how impressed I was with the essay. If I didn't know that you were a P1, I would have thought that this was at a much higher level of pharmacy school. So kudos to you and the effort that you put in. And I think that you and I have talked enough over the last year. I know that you are getting ready to be the president-elect for ASP at University of Charleston. And I look forward to seeing what you have in store at University of Charleston in the upcoming year. And I think that everybody knows by now, most of the students should know how committed WVPA is to helping our students through pharmacy school and giving them access to professional networks and education that will help to improve your life in school and hopefully set you up for better success as a young professional. So don't ever forget about the WVPA if you're struggling in pharmacy school, because we've got plenty of people that are dedicated to helping the young student pharmacists as well. So with that said, thank you so much. And you have a great rest of your P1 year. And we look forward to what's going to come the next 3.
Thank you so much. And thank you for talking to me tonight.
Mountain State Pharmacists is a product of the West Virginia Pharmacists Association.